Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We are located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you have a question, we'd love for you to stop into the office, but people are still a little reticent to come out into the world and meet strangers. And sorry if that's the case. You can call me directly at area code 845-561-2225. Again, 845-561-2225. It is my cell phone. I'll typically be the one answering that phone. If I don't answer the phone, please do not text that phone. The phone is not equipped to receive texts. I will never get it. I will never respond. It should kind of defeat the purpose for you to reach out to me. But you can email me directly at docrick, D-O-C-R-I-C-K, docrick@spineboy.com. And whether you stop in, whether you call, or whether you email, it's my pleasure to help you to better understanding what the concerns you have with regards to your health. Well, this week's particular video class is about your lungs and your respiratory system. And are you short of breath? There are lots of reasons for why people would develop shortness of breath. Some of them have to do with the lungs, some of them have nothing to do with the lungs, but either way, I'd like to help you if you are dealing with a shortness of breath. Good conditions, common conditions that people have, they're not good conditions, but common conditions that people have are things like asthma, shortness of breath, you get pneumonia, get bronchitis, upper respiratory infections, nasal congestion. These are all reasons why you may have difficulty breathing. Hiatal hernia, pushing up through the diaphragm, causing pressure on the heart and stopping the normal respiratory abilities. Appreciate that you're breathing and your diaphragm, as long as you're diaphragmatically breathing, which is breathing fully into your stomach as opposed to just into your chest, is about processing your emotions. It's what your diaphragm does. When you breathe fully in and breathe fully out using your diaphragm to do that, you actually process your emotions in a more balanced fashion. And that's a very, very good thing. Other conditions that people could have related to breathing would be sleep apnea. Sleep apnea is a condition that's quite difficult. Where people stop breathing while they're sleeping. Very challenging. But there's situations that can be done to help all of these situations. Things that I do here in the office, things that other healthcare providers can do in the office. And my job is to make sure that we get you well without any drugs or surgery. So we have several different supplements that we can use to help support the lungs and respiratory function. Primarily would be for people who have excess mucus. Excess mucus is typically due to a dysbiotic condition in the bowel, secondary typically to antibiotics, which disrupt your good bacteria, leaves the yeast and the candida alone. Then you eat foods that increase the yeast and the candida. If it's dairy and cheeses and those kinds of things, you're going to produce excess amounts of mucus. And if that mucus clogs the lungs, then you're going to have shortness of breath. You may get asthma. They may call it bronchitis if your bronchioles aren't expanding or contracting, and get inflammation of the bronchioles and the bronchi, hence the bronchitis. The things that you can do to help that, we have a supplement that is very, very helpful with people who have too much mucus, whether it's mucus in their head or mucus in their lungs. That's a supplement called Fenugreek. It's made of fenugreek seed. Best taken on an empty stomach with a big glass of water. Helps get into your system, get into the bloodstream, run around and eats up all that mucus like Pac-Man does in an old video game called Pac-Man. Just kind of runs around and eats up all the mucus. What else can we recommend for a person who has respiratory issues? We can make a recommendation for pneumotrophine Pneumotrophin PMG actually helps repair, rebuild, and remodel the lungs if the lungs happen to have an issue. We can use Emphaplex, which is specifically for people who have emphysema, shortness of breath as they get older. Bronch Effect, which is an herbal supplement that will actually help the lungs. We have another supplement called Pulmico, which is specifically for pulmonary issues. And then last but not least, we have Euphrasia Complex. And so these are the different supplements that we recommend for people. But getting back to some of the conditions that people have, bronchial asthma is defined as a reversible obstructive lung disorder characterized by increased responsiveness of the airways. And doctors are unsure as to what causes the underlying mechanism, yet appreciating the different components of asthma leads us to some natural solutions. Overt asthma attacks may occur when such persons are subject to various stresses such as viral infections, such as COVID, exercise-induced emotional upset, changes in temperature or pressure, inhalation of cold air or irritants, allergen exposure, ingestion of aspirin or sulfites in sensitive individuals. You can get allergic asthma from outside irritants called extrinsic asthma, or from internal infection, emotional factors, or irritants known as intrinsic asthma. Allergy is said to be more important in children than in adults, but evidence is inconclusive. Mucus production within the respiratory system is a byproduct of imbalances within the digestive system, as we mentioned before, due to the overgrowth of yeast and candida, as a result of antibiotic ingestion, followed by the consumption of refined sugar and dairy products such as milk or processed cheese. These increase the mucus production. Moving on to sleep apnea, potentially a lethal disorder in which breathing stops during sleep for 10 or more seconds, sometimes greater than 300 times a night. Can be obstructive, meaning in the upper airways, blocked despite airflow drive. Could be central, meaning decreased respiratory center output, or it could be mixed, meaning a little bit of obstructive or central. Obstructive sleep apnea occurs most often in obese people, with secondary pulmonary insufficiency. Complications include cardiac abnormalities, sinus arrhythmias, extreme bradycardia, atrial flutter, or ventricular tachycardia. Snoring is 3 times more common in obese people, and heavy snorers should have a thorough examination of the mouth, nose, palate, throat, and neck to determine where that asthma sleep apnea situation is coming from. Treatment would include weight loss, which helps to reduce the episodes as well as improves the blood gases themselves. For snoring, avoid alcoholic beverages, tranquilizers, sleeping pills, and antihistamines before going to sleep, as well as trying to sleep on one side with head and the body tilted up. That's sometimes difficult for people to do. So one of the ways that I can help you is through chiropractic manipulation. Believe it or not, every time you get a chiropractic adjustment, it opens up the airways within the bronchioles and the lungs themselves. So that would be a good thing to do, is to get a chiropractic adjustment. If you have emotional asthma, we can help restore balance and eliminate that effect with a technique called neuro-emotional technique. Fascinating technique that has tremendous results in eliminating the underlying emotional components to why people get the problems that they have, in this case emotional asthma. So my offer to the viewer of this particular video is during the next month of this whole month of October, if you have any one of these conditions related to your respiratory system, you can come in and have an evaluation. Normally $125 cost. That would be no cost to you. I would just need for you to call into the office and 845-561-2225. Tell me that you want to take advantage of the respiratory evaluation that's offered during the month of October. Call me, 845-561-2225. You can email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. But whether you call or whether you email me, I'd like to get you in, have an evaluation, figure out which one of these supplements and adjustments that you would need to help improve your respiratory system and possibly get rid of your asthma, get rid of your sleep apnea, and get you back to better health. So I want to thank you for tuning in to this week's free video healthcare class, and tune back in next week, same health time, same health station. This is Dr. Richard Untune from Advanced Alternative Medicine Center saying, I look forward to supporting you when your health matters.